Welcome back to the Arizona Daily Mix. There is an addiction problem among pregnant women, and to help further the conversation, change the stigma that exists about this problem is Dr. Maria here with us. Good morning, doctor.
Hi, how are you this
Fine, how are you doing?
Good.
Okay, we were in the green room, and I'm going to give it a try. Pronounce the last name, doctor.
Manriquez.
Manriquez. Dr. Maria Manriquez.
That's right.
There we go.
Excellent.
So, I like it. Then she was correcting me, because you really want to correct some people out there today about the stigma about pregnancy and addiction.
Yeah, I think the most important thing is we like to use words that just carry a lot of stigma. Addiction, abuse. And really, addiction, it should be recognized as a use disorder, so substance use disorder. And addiction, abuse, sometimes is more dependence. So some of the things that we'll talk about is kind of the opioid epidemic that we were dealing with prior to the pandemic.
Yeah.
And so
that's the conversation you have. And I'm listening to you because I think we think of addiction as drugs, like the hard drugs, you know, cocaine, heroin and stuff, but not thinking about what's right in the medicine cabinet, which a lot of the pregnant women start to use because they think it's safe. They think, okay, you know what, the doctor prescribed it to me, it's okay for the baby and stuff, we're going to be okay. But it gets out of hand. Right,
absolutely. So what we do know is as early as just 2 weeks of use, so imagine you have a broken ankle and just 2 weeks of use can lead to a dependency. So what we describe as misuse of prescription drugs is when somebody is using the medication that it's either not prescribed for or getting the medication from somewhere else.
Yeah, and with being pregnant, I mean, you're worried about the child.
Sure.
But sometimes you might make those decisions to, you know, well, if I take care of myself and take this, I'm going to take care of the baby too.
Well, a lot of times women that are using when pregnant, it's gone to that point of dependence, right? So they're no longer, if they ever did use the substances for a positive effect, now they're using it to avoid a negative effect. So they don't want to experience the withdrawal symptoms or the discomfort, and quite intense. So I'm sure many of your viewers have actually, unfortunately this year, had COVID. And that I had a couple of people tell me and describe what it was like, you know, the sweats and the pains and the aches. This is what someone who would be withdrawing would experience. So they want to avoid that. And frequently, once somebody is dependent on a substance, even nicotine, you want to avoid the negative effect. It's more the avoiding that is happening. And so it's a big conflict for patients who are pregnant and wanting to do the best that they can for their babies, but also not wanting to hurt.
Yeah. Do you sit down with them and talk with them? Because, as I said, some people think, well, my other doctor prescribed it, so it must be okay for the baby, and not really thinking, you know, what's going on.
Sure, yeah, we spend a lot of time talking about it, and that's a really big topic, especially when we're talking about opioids. So any opioids, in whether it's prescription opioids, synthetic fentanyl that can be gotten on the street, or heroin even, any opioids, including the ones that medications that we may give to help them get better, can cause neonatal abstinence syndrome or neonatal opioid withdrawal symptoms. So we try to explain all that and get patients understanding and have appropriate expectations, but doing it all with respect and compassion and treating people as the humans that they are.
Yeah. We were saying earlier, and I hope you correct me on this, but we were saying that, you know, pregnant women sometimes don't want to get help because they feel they're supposed to be the strong person and supposed to be, you know, very, kind of say the mother and everything. So they don't really go ask for help.
They don't, and a lot of women are probably suffering silently. There's a lot of shame associated, and even I think in our own unconscious bias, we may not intend to treat people differently, but it happens, and we've taken histories on patients and asked questions, and a lot of times they get just treated differently because somebody will learn, you know, oh, they've been diagnosed as having a use disorder. And so, unfortunately, use disorders, just like any other chronic medical condition, hypertension, diabetes, we could argue that many of those chronic conditions started with, you know, maybe not eating well or not exercising, and making those kinds of decisions. So once you get to the chronic disease portion of substance use disorder, it really is, it's like any other chronic disorder that needs lifelong attention, and so that's what we try to provide.
What else is there that you provide to help them get off of course, being addicted?
Sure. Well, there are lots of medications for a lot of substances. For example, tobacco, there's nicotine patches. For alcohol, there are different medications. For opioids, likewise, there's methadone, there's buprenorphine. Buprenorphine you can get in a doctor's office if the doctor's been waivered appropriately with the DEA. But there's wraparound services, and so we provide an intensive outpatient program at the institution I work at. I see patients at Banner and the Women's Institute. So we have a lovely HEAL Foundation. It was the Halley Foundation that gave us some money that we were able to start this incredible intensive outpatient program. And then right across the street, we have a family practice office, but we have 2 addiction medicine specialists right there. And so moms come, dads can go there. If they want to see me, they can see me as well. Dads, I'm an addiction medicine specialist besides being an OBGYN. And so we have everything just very available, and that's that wraparound care. But you know, at the end of the day, that behavioral health, that family support, that just breaking down those barriers of stigma is really, really what matters.
Yeah. I like what you said about dads going to. It's not just moms, but it's dads too that need to come in there, because once the mother sees the support from the husband and the father, it really does help push them along to get off the substances.
Absolutely, and often it's partners that are using as well, husbands, partners, even family members. And so once they realize that there's a place where there's healing possible, we can move in a better direction. I think everybody wants to be feeling good and healthy and strong.
Yeah. Amazing, doctor. Please tell them where they can find out more information.
Well, I do have a website, but if a patient were to want to make an appointment, 602-521-5700, and then that is the Banner Women's Institute right at the Banner University Medical Center.
Perfect. Doctor, thanks for joining us this morning.
Thank you. Thank you for having me.